Good afternoon. I'm Sean Moynihan from Malone, and I'm delighted to be here today. And like to thank thank everybody for the invite and this opportunity. And what I hope to cover today and do justice to the staff, volunteers, and partners we have is what do we do, how do we do it, the support we get from Sláintecare, what we've done to respond in COVID-19, and then some of the learnings. Alone is a merger of five organisations that supports and empowers older people to age at home. We do this by having an integrated system of coordination of supports, providing practical supports, befriending, um, phone services, social prescription, housing with on-site supports, technology and assistive technology to, to use support plans and create a point of contact to access a range of health, social care, housing, transport, and other areas of need that arise for the older people we serve and work with. I think our aim always is to improve the health, the physical health, the emotional health, and the mental health and well-being of the older people we serve. Two other things we do is one, we provide technology, training, and knowledge to other agencies to do what we do so that we can create scalable models and collectively respond to what is an aging demographic. And finally, we're involved in mapping where are the older people in need and then working with others to align services to those locations and to help people use technology, whether that's in hospital discharge or in other scenarios, so they can age safely and securely at home. Alone services operate across all CHOs, and our aim under our strategic plan is to support 45,000 older people nationally a year, to provide 27,000 of them with support plans, another half a million visit support and befriending visits, and half a million support and befriending calls. Also to provide 36,000 units of social prescription with the support and help of other agencies also in this area. And also we will provide training, support and technology and computerization to 100 other agencies across the country. In this area, we've had wonderful support from Sláintecare, and our Sláintecare project is about linking healthcare, social care, and community care together using technologies to benefit the older people, with a huge focus on the use of technology prescription to those being discharged from hospital, and also having a situation that we get increased collaboration, cooperation, and people using the same processes to support older people to age in place. Building on our work from our strategic plan and the work we've been doing and supported from the Sláintecare program, um, allowed us to switch from operating across CHOs to still doing national coverage, but we split our staff into work stream. One work stream looked at the older people and supported the older people living in our housing. Another work stream of staff worked at the older people already engaged with us to ensure support plans, social prescriptions, um, volunteer engagement continued with those older people. Then we had a work stream around National Support Line, which operated 8 to 8, 7 days a week, and that still continues. And we went through the phases probably of public health information, then working with those older people around practical supports, health and well-being, and really now supporting people as the country opens up. Fourth work stream was actually fulfilling those practical supports, whether that was around food, medication, solid heat, or other housing and general health needs people needed. This was backed up by our technical and human resource services, where ultimately that work stream of staff just making sure that our 2,500 volunteers, our staff were well supported, retrained other people who came to us at that time, and also make sure that our IT infrastructure withheld the pressures that we were under. Uh, the sixth work stream you see there is partnership work stream, hugely important. We shared our protocols, our practices, our public health information our initiatives with over 250 agencies, and ultimately is we try to keep in touch with everybody to also make sure that we could help create a coordinated response, including those in civil society and engagements in NGOs, to ultimately respond to every older person that came to us. Our seventh work stream is we managed to keep our Sláintecare project running, especially around using technology to map the data, the supports that we were giving older people, and the technological prescription to older people. In the centre, we had a situation where all the reports came into there, and ultimately as we provided reports and worked across the CCMA, the LGMA, and the local forums in 31 counties, and reported into three different government departments to provide them with the information and knowledge that we were getting every day. This is a nice, neat diagram, but the reality of it is that we integrated all of these services and rebuilt our quality system so everybody coming through the national support line could access all the services that we offer and could offer. This slide shows the data on the support we've provided since the start of COVID-19. 25,000 calls received, over 110,000 calls of support given, 16,500 units of practical support, 12,000 older people being supported on an ongoing basis, 76% of all callers living on their own, and a system to support those who are considered vulnerable adults on an ongoing basis. The enabling factors for all of this was a skilled workforce, quality standards already in place, an IT infrastructure, and partnerships and relationships built over many years, and now new partnerships with civil society like the Guards, the GA, and on Post. The sustainability here, we think, is that this aligns to our strategic plans and goals and Sláintecare support we've been getting. And ultimately is we're enthusiastic about the new interest from everybody in the use of technology and the integration of services. I think we should celebrate the capacity both of the NGO sector and also of the statutory sector to implement change at pace. And I think this bodes well both for Sláintecare and the other strategies that are in place that are around health and well-being and support of older people in the community.